Hi everybody, this is Priya Kumar. Today I just want to discuss about speech therapy and its importance and when your child really needs an attention of a speech therapist. When you feel that your child is not speaking even in 3 years or 4 years, and if you find that some of the sensory issues which I have shown in the previous videos, like spinning, jumping, bouncing, running, not maintaining eye contact, name call response poor, speech delay is present, and sitting tolerance is not present, and those features which I have showed in the previous video, you check with the video. If you have the certain features and still your child is not speaking, which he is supposed to do at his current level age, he is not able to do it, then it is a time for the parents to discuss with a speech therapist. First, move to a pediatrician. He will suggest you the right way to do it. Once you check with the pediatrician and everything is fine with that, then you can go for a speech therapist definitely. Why I say it is very important is, like, all children are not mute, and they don't have any problem in speech. Why? Because if you go to a speech therapist at a right time, there is 100% possibility for your child to get back their speech to their age level. Though it takes time, it's going to be a worth process. Like if you're not sure whether your child has problem in speech, or is he as age concern or hereditary or genetic criteria, whichever states, like there are genetic criteria, like children may acquire speech during delayed or any duration, they'll be acquiring it. But what I'm telling is, like, now you have so many opportunities. Now we are not like we know certain things, like when to do things, when to not. Today our situation is very different. We don't have a joint family where the parents and all the people are with us, and they are not there to boost the child. Now only a mother and a father has been accompanied with the child, and the child is not having any exposure to the external environment. And most of the time, if the child is alone with the mother, so mother, I'm not I'm not blaming the mother, but still mother will also not have a particular time to the child. So when she is not having time, she just switch off the TV or mobile, anything is being handed over to the child, which the child starts going into it. And finally the outcome will be like, after 3 years you come to notice that your child is not speaking to the age level where the other child has been acquired. Okay, now you have come to a conclusion that there is a problem in your child, that the child is not speaking. You understood. Then put them in a crèche or a play school. Why I'm saying this, like, peer pressure is more important in speech, not as in speech, in every process. That is the place where you can identify that the child is really having a problem or it's just a milestone. Because delay is possible, but the delay for quite a longer period, it's dragging it, then it's an issue. So you have to consider the issue at that particular time. When you see, like, when you have put your child in a crèche or a play school, but still your child is not acquiring speech, then I think it's definitely your time to go to a speech therapist, analyze with him. If the speech therapist refer for an occupational therapist, go for it. Before them all, you have to go to a pediatrician, consult with him, like whether the child is having everything in a normal phase. If everything is fine and there is no problem in it and no issue in it, then definitely go to an occupational therapist and a speech therapist at that point of view. Once you are done with a speech therapist, if your child is not having any sensory issues or any other correlated spectrum disorders, then definitely the child is only having problem with speech, and which is easily correctable. Why I'm insisting you people to just go on to a speech therapist before 3 years or something like that, because Actually, we don't have ample of time. Once child achieves 4 years, it will be difficult for parents and for the therapist